Hello everyone. Today I'm going to tell you about cardiac radiologist, which is the specialist that I aspire to be. So, without further ado, let's move on.
So I will begin first with describing on what is cardiac radiologist. So cardiac radiologist is a subspecialist in diagnostic radiology who focus on the heart. They use advanced imaging techniques to diagnose and monitor heart disease, and they work closely with other healthcare providers to guide patient care and management. And cardiac radiologist is a part of diagnostic imaging department. So there are three key responsibilities of a cardiac radiologist, which one of them is diagnostic imaging, where they perform and interpret imaging studies including echocardiograms, cardiac CT, cardiac MRI, and nuclear medicine scans. They also involved in assessing the blood flow, coronary artery blockage, so that they can identify causes of symptoms such as chest pain, shortness of breath, and fainting. They also involved in the interventional procedures where they assist in minimally invasive procedures like angioplasty using imaging guidance, and they also involved in collaboration and communication, which they provide detailed reports of imaging findings to referring physician through RIS, and they collaborate also with other radiologists and other specialists for patient care and management and for the treatment plan, and they also guide patients through the imaging procedure to ensure the preparation to ensure the imaging is clear and does not need a repeat procedure. So we can say that cardiac radiologist is responsible for the disease management and collaboration, which they diagnose the disease to see what the heart conditions is, such as valve defects and congenital heart disease, and they also monitor the disease, which they monitor the progression of the disease and assess the effectiveness of treatment. And again, they collaborate and communicate, which they provide data reports of imaging findings to referring physician and collaborate with radiologists and other specialists for patient management and treatment planning. So there are some required skills and competencies that required of a cardiac radiologist, which one of them is imaging expertise, where they need to be expert in imaging modalities so that they can find a clear image of the scans, and they also need a strong analytical skills where it is important to interpret the complex imaging findings accurately, and I also need the communication skills which can help them in communicating with the referring physician, radiologist, and patients. And the last one is interventional procedure, which they need to be familiar with interventional procedure. So I would like to see the overview first of the heart disease and its category. The first one is coronary artery problems, which is blocked coronary arteries, which they can reduce blood flow, leading to ischemia, which is reduced oxygen supply, causing chest pain or angina, and myocardial infarction, which is heart attack. The second one is weak heart muscle, which is the heart failure results in fluid buildup in lungs and cells, shortness of breath, and exercise difficulty. The third one is valve problems, which is the causes by the stenosis or regurgitation, which is the narrowing or leaking of valves, causing heart murmurs, heart failure, fainting, and exercise challenge. And the last one is rare disease, which seldom happen, which is one of them is infiltrative disease, which is the abnormal substance build up that weaken the heart. Congenital heart disease that refers to structural heart defect present from birth, and cardiac tumors, which is either benign or malignant types. So, cardiac radiologist uses these imaging techniques, which is five. One of them is echocardiography, which is non-invasive that evaluates heart function and valve. There are two types, which is the transthoracic external and transeophageal, which is internal. They also can detect damage from chemotherapy or radiation for breast cancer. And the second one is nuclear imaging, medicine imaging, where they assess the blood flow under stress and rest using radioactive tracer. They often combine it with the CT, which requires avoiding caffeine on the examination day. The third one is cardiac CT, which uh, needs for the calcium scoring, which is measured of classification to assess blockage risk. The the coronary artery CT, they evaluate symptomatic, which about the patient that have frequent symptoms in their heart, cause chest pain, which is caused by the plaque buildup. The fourth one is cardiac MRI, which identify the causes of heart dysfunction, infarct, arrhythmias, and cardiac masses. They are often at long in took long time. They requiring IV, EKG leads, and frequent breath holding. And the fifth one is not imaging techniques, but crucial tool, which is stress testing, which they evaluates heart function during physical and chemical stress. There are several types such as treadmill or pharmacological, which is the chemical. So now I would like to talk about the cardiac imaging department workflow, which is the first one is the patient referral scheduling and check-in, where the referring physician usually send patient referrals for cardiac imaging studies to diagnose or monitor heart conditions, and the staging staff will arrange appointments based on the urgency of the referral, and the patients arrive and complete necessary documentation, including medical history, consent form, and pre-procedure questionnaires. And the second one is the preparation for imaging procedure, where the patient are prepped according to the imaging modality. Safe protocols are reviewed, including allergy checks and medication use, which other measures are used too, such as the change, metal object removal, and contrast media if necessary. The third one is imaging acquisition, uh, processing, and quality control, where appropriate imaging modalities are used based on the clinical question. And these radiology technologies will collaborate with radio cardiologists, which to ensure the high quality imaging acquisition, and the image then will be processed using advanced software for reconstruction and analysis, and there will be some quality control to ensure clarity and accuracy of the image. The next one is radiologist interpretation and report regeneration, which image are reviewed by radiologists with other experts to identify abnormalities. This diagnostic report is generated too based on the discussion. And the last one is The final report will be sent to referring physician electronically via the RIS, which is Radiology Information System, except on some cases that need from patient management. So for the education and training pathway for cardiac radiologists, usually it took 12 to 14 years of training to become a cardiac radiologist. And the first one is where we are currently are at the medical school, at which we will took 5 to 7 years, which is the for the Doctor of Medicine course, and we will spend 2 years for internship, which we will have the hand-on clinical experience in multiple medical fields. We will spend 4 years for residency, which we will learn about the comprehensive education in general radiology, including interpreting X-ray, CT scans, MRI, ultrasound, and nuclear imaging, and 1 year in fellowship, which we will follow in susceptibility training in cardiac imaging, including echocardiography, cardiac CT, cardiac MRI, and nuclear imaging technique, where we will follow an expert and learn from them.
So that's all from me. If you want to know more about cardiac radiologists, you can always search on the internet. Thank you for watching, and I will see you next time.